Do you know someone, or are you personally battling a drug and alcohol addiction? Why are so many people addicted today? And why have so many people died as a direct result of this disease? If you've been affected by this problem and want answers like we do, then join us in our efforts to face this disease. Our purpose is to examine the truths, expose the lies, and uncover and provide resources to this affliction. Come, join us in this journey. Welcome to Addiction and Recovery TV. You might want to take a moment to contact your friends, tweet them, Facebook them. We are a broadcast that you will not want to miss. I'm Charlene DeChico. I'm your host. I'm joined today by my co-hosts, Deborah Braden, Johnny Raggio, and Ken McDonald. We are Addiction and Recovery TV. This is a broadcast that will discuss and identify the problems and solutions revolving around addiction and recovery. This program will illuminate the pathway of truth about addiction and recovery in the efforts to impact and change our perspective about what we already know and what is yet to be explored. With that, please help me welcome my first guest, Deborah. Deborah is our Mouth of the South social worker. She is a LCADC, which is a licensed clinical alcohol and drug counselor and certified clinical supervisor and licensed social worker. Please help me welcome Deborah.
Many people have been touched by addiction, either directly or indirectly. Join us as we educate and break the stigma associated with addiction. Together, we can start a revolution and bring the disease out of the darkness and into the light.
Great. Next, we have Johnny Raggio. Johnny is our treatment and recovery liaison.
We are raising awareness and exploring options in order to generate more resources for treatment. With over 20 years of experience in the treatment field, I am passionate about breaking free from the limitations of treatment today.
And last but not least, we have Ken McDonald. Ken is our everyday guy with an everyday perspective.
From the beginning, people have been dying from addiction. This epidemic has been evolving, although today it's center stage. This is the time to fully understand what we are up against. My involvement with recovery is heartfelt and sincere. Unite to face addiction.
When talking about the disease of addiction, it's important to define the topic. Deborah?
According to the American Society of Addiction Medicine, addiction is a chronic relapsing brain disease. It's characterized by compulsive drug seeking and use despite harmful consequences. It's considered a brain disease because drugs change the brain. They change its structure and how it works.
So, we recently went to Washington for the Unite to Face Addiction rally where we interviewed Dr. Oz. Let's hear what he has to say about addiction. Let's take a look.
Hi, I'm Charlene DeChico from Addiction and Recovery TV. I'm here with Dr. Oz, and we are at the Unite to Face Addiction rally here in Washington, D.C. It's been an awesome day so far, a great energy, and people are just here to support, educate, and inform everyone on what's going on today in our society with addiction. And so just a little bit, at Addiction and Recovery TV, we educate and inform and provide resources to people in understanding more about addiction, just like what was going on here today. And so we just want to ask you, first and foremost, what you would like to see as a direct result of your involvement here today at the rally.
Well, I'm definitely improved as a human being from being with so many wonderful folks who have suffered and have gotten better, some more than others, from the ravages of addiction. What I'd love to see from today's event is that understanding that the silence will end. Yes. No longer should folks who have suffered through addiction, whether they're currently in the throes of it or whether they've recovered, hide the reality of what they've been through. First of all, it's the only way we're going to be able to transparently in our society rip off the scab and allow badness to flow away so we can actually heal as a country. But also we're losing 20 plus million people as allies, folks who've been addicted and are in recovery and can attest truthfully that recovery is real, because most of the folks who are still addicts don't think it is. And that's true for mental illness too.
Right, and so that brings us to the topic that addiction is real, and if you know, in recovery they have classified it as a disease. Are you familiar with the term disease of addiction and understanding that that is a statement?
I've heard numerous people today say addiction is a disease. You need to treat it like a disease, which means you need professional help, but you got to also rally around folks and stop picking on them. because, of course, if they could do it, they would. And their minds don't want them to get better, and they'll ostracize people around them, so they sort of isolate themselves, which further worsens the scenario. So you begin to understand the deeper pathology of how it affects families. Of course, 1 in 3 families is influenced in some way by this. You begin to appreciate that we've got a global scale problem on our hands.
Awesome. That's a great answer. And just from a medical standpoint, I wanted to ask you that with doctors today and medications, and people sometimes can abuse them, do you think that doctors should be more, become more aware and maybe even receive special training just to understand what's going on with addiction? And
So I'm going to Capitol Hill tomorrow, talk to a bunch of wonderful folks who want to hear me, senators, congressmen, and we're testifying on Tuesday about this as well. Less than 5% of doctors in medical school are given insights into drugs and narcotics in particular, and their safe dispensal. So how could we know about them? I never got formal training in it. Yet as a heart surgeon, I do give people narcotics in order to deal with their pain. But to understand the ravages of a person who's already susceptible to a narcotic, on a narcotic for a week or 2 or 3, is something that most of us aren't really attuned to in the medical profession. See, I think the big allies here might be the nurses, because the nurses talk to the patients in a much more comprehensive, soothing way. And so instead of just giving the answers, they'll sit there and say, listen, these drugs are good for your problem, your back pain, but just you should know that these are some potential pitfalls. And here's how you're going to store them. Here's how you're going to dispense them. Here's how you get rid of them, because you don't want to stick them around your house because, God forbid, your kids get into them. Things that we actually don't even bring up as a conversation point. The reason I think those are valuable assets to discuss is because if a patient realizes these are so dangerous, I got to get rid of them as soon as I'm done with them. They're not like an antihistamine. Well, now I'm going to be more cautious about taking them myself as well.
good. And again, with raising the awareness, very good. Thank you for sharing that with us. And again, we wanted to thank you for your involvement, your support. We think that it's been a very effective day. And so do you just have any closing remarks or anything you'd like to let our viewers know back home about addiction and just the rally and possibly something that people can do at home as a takeaway from coming here today?
I think we're at a tipping point in America. There's a renaissance in addiction it is sweeping the nation. And part of it is catalyzed by the fact that we have such a huge uptick in the number of folks who have died from opiates. You know, number one cause of death in people under age 50 from accidents is now, unfortunately, opioids. So I think we can be smarter with the way we talk to our doctors. Ask the extra question, do I really have to be on this and for how long? Make sure that if you're going on a narcotic of any type, you tell your family members about it. It's a nice security check. Yeah, and if you don't want to have that conversation, it should be a red flag to you and people around you that something might be wrong.
Well, we appreciate your support. We know that if Dr. Oz is on board, that we are raising awareness, and you heard it here first, ladies and gentlemen, and it's time to unite. We are here uniting, and the silence is broken, and so we just are grateful to be here tonight.
God bless you.
We hear Dr. Oz say that addiction is an illness. With that, we're looking at a resource, a very powerful informational resource, a book called Slaying the Dragon, The History of Treatment in America. This book is a powerful resource that we will be using in our conversations.
As early as 1784, a doctor named Benjamin Rush wrote about the consequences of chronic drunkenness and argued that alcoholism, that it was a condition, a disease that should be treated by physicians.
Argumentatively, so alcoholism was recognized as a disease. However, drug addiction was not. It was characterized as a moral deficiency. Therefore, treatment was virtually non-existent.
When you talk about moral deficiency, what's interesting about that is we also had the opportunity to interview Dr. Murphy, U.S. Surgeon General, and he mentions in his interview about the moral deficiency.
Hi, this is Charlene DeChico with Addiction and Recovery TV. We're here today with the U.S. Surgeon General, and we are at the Unite to Face Addiction rally here in Washington, D.C. General, would you like to tell us why you're here today and what is your involvement with this rally?
Well, first of all, I'm here to support the many people and families that have come here to say that we need more help in ensuring that we treat and prevent addiction in our communities. And I'm also here to announce that we are doing the first ever Surgeon General's report on substance use, addiction, and health.
Thank you. And what would you like to see as a direct result from your involvement here today at the Unite to Face Addiction rally?
Part of what we need to do as a country is change how we think about substance use and addiction. We have to stop thinking of it as a moral failing and instead recognize that it's a chronic illness that needs to be treated with the same compassion and urgency as any other illness.
Awesome. Well, we thank you so much for your time, and we thank you for being a part of this record-breaking historical moment here in Washington, D.C., and we thank you for that you're going to get up and speak and have something to address to the people in dealing with this. Any closing remarks or anything else you would like the viewers to know?
Well, I just want to say how grateful I am to be here, and we can't succeed in this movement to overcome addiction without the support of each and every person in this country. So we got to do it together, and I'm happy to be a part of it.
Thank you so much for your time.
Thank you.
That's interesting information.
Since 1890, just some food for thought, heroin was sold as a non-addictive substitute for morphine in aspirin form. Another use was children suffering with a strong cough. Cocoa wine. Anyone? Metcalf wine was also used as in a huge variety of wines with cocaine and worked as medicinal treatment.
So that's cocoa wine you're talking about, and there's some other things too, right?
Mariana wine, yeah, it was pretty cool. You know, actually the Pope had given a Vatican award to Angelo Mariani in 1875 because his wine was the best. For asthma, 40% alcohol plus 3 grams of opium per tablet. So it was very popular for children. There was another thing called cocaine tooth drops.
For children?
Yeah, so they relieved the pain, but what else did they do? And last but not least, opium for newborns.
Opium
well,
for newborns.
They did sleep, but what else happened?
Wow, interesting.
Yeah, the opium was in a medicine called paregoric, and they would just put it right in the bottles
absolutely right,
for the
yeah.
babies to sleep.
Yep.
Never knowing, of course, back then that you're beginning the addiction for your infant child. And also, in the 1880s, Sigmund Freud was actually recommending cocaine for the treatment of alcoholism and morphine addiction. And it was, you know, they actually bottled home cures of liquids for alcohol and drug habits. And later on, it was exposed, and those bottled medicines that were supposed to cure alcoholism and addiction actually contain alcohol, opium, morphine, cocaine, and even cannabis.
There's many publications that talk about addiction and recovery, and we've even been addressing it on some level in society at large. We have fellowships, we have treatment is available, there are medications, but what about what is still needing to be done? So from a services perspective, Deborah, what can you tell us?
Well, I can tell you that the misuse of prescription drugs, which is a big worry today, prescription drugs, i.e. opioids, is second only to marijuana for drug abuse these days. The most commonly used illicit drug is marijuana.
That's amazing.
But a close second is the opiates.
That's amazing. I mean, just that statement, we will be going into that more. And so from, as far as services, they do have drug court programs and...
Yes, they do. There's over 2,700 drug courts across the country in America today. Those were, of course, the 2014 stats. They continually grow in each state. They're proven to help because the concept is instead of locking an addict up, let's give them treatment. And, of course, the money, it's way less expensive to treat an addict than to punish them and incarcerate them.
So from that standpoint, what can you see still needs to be done?
Well, I believe that transition needs to be looked at more clearly and more closely. When clients are in treatment, whether it be residential, inpatient, or outpatient, there has to be some type of transition. So they don't go back to the same environment. They don't go back to the same world. They don't understand how to live a life. So we need to help them transition from treatment to the community to self-help so they can learn how to live without drugs.
Great. And Johnny, so from a treatment perspective?
Treatment perspective, the longer the treatment, the better the outcome. So, that being said, of course, the longer term treatment is probably the best option with umbrella coverage as far as an intensive outpatient, partial hospitalization like Debbie spoke of, because most of the clients who go to treatment are ones who cannot go back to that environment at home, or it's it's not a conducive environment to recovery. So the longer the treatment, the more available treatment, the more dollars that we can put into treatment, the better off we're going to be.
So we have transition, we have long-term treatment. How about you, Ken? What do you think as far as what's still needing to be done?
Well, I mean, I think that addiction is a family disease, so we need to educate and support families and let them be aware that help is possible for their loved ones. We realize that it's a difficult thing to admit, but we want to support people in education, not only, group type sessions where people can talk, but even events where people can go to and kind of commingle with other people that suffer from the same affliction. That being said.
So there you go. We're beginning this conversation, and we've talked about some interesting things: treatment, transition, families. And so when we come back, we're joined today by Kevin Mira. He is the founder of City of Angels, and he is the founder of City of Angels, and City of Angels is helping with family and resources.
Absolutely.
So we'll hear from him, as well as Sonia Horowitz from Liberation Way. So please don't go anywhere. We are going to have a great show for you guys, and we are just getting started. We'll be right back. Thank you. Welcome back to Addiction and Recovery TV. We are joined today with our guests, Kevin Mira and Sonia Horowitz. First, let's start with Kevin. Kevin is the founder of City of Angels Radio, and Kevin also lost his son as a direct result of a drug overdose. Kevin, can you tell us a little bit about the loss of your son and the establishment of City of Angels as a result of that?
Sure. On June 30th, 2008, my wife and I found my son, Kevin. We called him KC. He was 24 years old. We found him dead in his room from heroin overdose. Heroin was kind of foreign to us. We're a middle-class suburban family from New Jersey. And be honest with you, we weren't prepared for it. And so after his death, friends of his and parents of friends of his came to us for help. And as most parents who are faced with this, we didn't really have much of a clue. But we set out to see what we could do, and then by March of 2009, we took some money out of his memorial fund, and we formed City of Angels, which is a nonprofit in the state of New Jersey.
So the pain kind of turned into purpose with starting the City of Angels network, and we're going to ask you to talk a little bit more about the primary function of what you guys do and how you are helping people. But I also want to first introduce our next guest, Sonia Horowitz, and Sonia is from Liberation Way. Sonia, you want to tell us a little bit about who you are and what you do?
Sure. Well, I am the lead primary therapist at Liberation Way. It's an organization in Yardley, PA. We've been open since the end of July, and we really just take a multidisciplinary approach to treatment. We try to focus on individualized treatment for individuals suffering with mental health and addiction.
But you could talk a little bit about the link between mental health and addiction, and so just give us that little overview about the disease.
Sure. I think, in the past, mental health and addiction were looked at as two separate disorders, and they really weren't treated together, when in reality, I think more than 50% of people with mental health disorders also have addiction, and they really need to be treated together. There needs to be collaboration between treatment providers. A lot of times people are suffering from mental health and start using substances as a way to self-medicate an already existing mental health condition, and then what happens is they end up actually changing their brain chemistry, and so sometimes they create new mental health disorders as a result of their drug use.
Sure, and I just want to ask you, Kevin, to tie into that. Would you say that you noticed, or did your son have any mental health issues or concerns prior to his?
Anxiety and depression, Charlene. That's what we find, that most of the kids we work with are dealing with anxiety and depression. Of course, when you get into the more serious mental health disorders such as bipolar, we see that too. And but anxiety and depression, He had started with pills, which is what most of our kids
Right.
are starting with, and then it progresses into the heroin, mainly because of the cost. But anxiety and depression he was suffering with, and of course he got treatment. He was doing IOP, but then when it comes into the heroin, which he was only doing heroin for a very short time, and you know, that's really rapid, the heroin use and the downward slide once they get into it.
Like Kevin mentioned and talked about, that he did indeed lose his son from overdose, and we know that in times past that we haven't had resources that could possibly save lives. Maybe you lost someone due to a drug overdose, or you know someone that has, and what has been a sad state with that is that sometimes when the emergency comes, it's too late.
Or people were scared to call the emergency room. People would be
Right.
overdosing. They were scared to call 911, or they were scared to go to the emergency room because they didn't want to be charged with any type of charge that could come along with someone overdosing.
That's very
Or it
interesting.
happened in the middle of the night
Right.
when everyone was asleep.
So, with that being said, that's why we want to talk about now things have changed, and what a great thing that is. There's actually a kit out there that can help save people's lives, and Kevin was nice enough today to bring that kit with us, and he's going to tell us first what it is. We have it here. I have one here. It is a Narcan treatment kit, and then Kevin's going to show us with the one in front of him of what this kit is and what does it do, Kevin? Can you tell us?
That's an undisturbed kit. Naloxone, or we hear it commonly called Narcan, I guess you might want to call it a miracle drug because it reduces the effect of the overdose immediately. And so it hasn't been readily available. Massachusetts was really the first state to kick it into gear because it is a prescription drug. And so you can't get it without a prescription.
Okay.
But in Massachusetts, the state signed a prescription with the state doctor, and then it was deployed to the police departments. They followed suit here in New Jersey about a year ago, and so most of our police forces have Narcan kits with them. There's two kinds. There's intramuscular with the needle, and then what I have here is basically a nasal. And so it's a pretty simple kit. You're trained on it. Doesn't really take much, just a little bit of concentration. This is the nasal applicator, and then what you do is just simply twist it in place, and then this is your Narcan. And all you have to do is pop the top off, assemble it right in here, and it's ready to go. And it just goes up
So it's
one.
nasal.
Yes,
mist.
absolutely. It's a mist, and it's very effective. As a matter of fact, the first save in Mercer County, New Jersey, we interviewed those police officers. When they got there, the young man was dead. He was gray. He was ashen. And they've been trained in it, and then when they applied it, he immediately sat up. It actually
Wow.
just scared them a little bit because
Wow.
they weren't ready for that. And it's very emotional for them after. So it's a life-saving
It
kit,
sure is.
and it's out there now.
And that's what's amazing, and that's why we wanted to talk about it, because honestly, I was unaware of it. And so this is news to me, and it's actually groundbreaking and fascinating news. So I'm just really ecstatic that you were able to bring it and share that with us. We want you to tell the viewers how they can become trained if you know.
Right.
And Sonia, maybe you want to comment on that as well. But Deborah, you wanted to ask or make mention
I
of
just wanted to state a fact about the Narcan. It was passed in the last year, 18 months. It is called the Good Samaritan Law. And actually, anybody that goes to a training, people in the home, their average person, police, can go to a training, and upon completion of the training, they will get a kit. And, you know, unfortunately, many people had to die before we were able to get this in the hands of the public. But it really does, just like Kevin spoke of, it's instantaneous awakeness, if you will, from the overdose.
Now, do you have information about that on the radio website?
Yeah, on City of Angels website, you can get information. TOPAC, T-O-P-A-C, is a nonprofit in the state of New Jersey that trains you for free. They're out training in hospitals, in IOP, so on and so forth.
How
But
long
then
is
there's
it?
the
How long
training.
did- yeah.
It's probably less than 30 minutes to be
Oh,
trained.
okay. Because
Yeah.
a lot of people think training, work,
No.
it would inhibit them doing it.
Yeah.
30 minutes we're talking about to save someone's life here?
Absolutely. Absolutely.
Maybe a little longer, similar to maybe a CPR one day. Certainly you can do it, you set aside a schedule or a time and have it in that day depending on the training. There are programs in the making right now in the state of New Jersey to hook treatment providers up with a contact person in the emergency room for someone that comes through and is brought back to, if you will, from Narcan. There's going to be a person right there to hook them up with treatment so they have something to know, somewhere to go. And so they're not just immediately brought out of an overdose and then bye-bye, go home.
Wow.
Very important.
Yeah,
Yeah,
and it's,
yeah,
it's
it
something that treatment centers are doing, or the treatment providers are becoming trained in Narcan and having it available because when you're in an outpatient setting, there's often times where your client is there and could potentially overdose. So.
And so, Kevin, going back to from looking at the disease of addiction from an outside look, although we do talk a lot about the addict and treatment, what we also would like to focus on is understanding how people deal with the disease from the outside. So I'm sure that you could share with other family members or parents ways to better understand the disease, signs to look for, just some tips, share your hope with others about
Right.
having gone through something like that yourself.
Right. As I said, City of Angels is a nonprofit in the state of New Jersey, and a lot of what we do is about community awareness. We speak in whether it's schools, churches, hospitals. So we're out there and we're helping people get educated. We do have programs we call family programs to help educate the family. Because as I can tell you from my experience, we weren't tuned in to what to do, how to do it. The system sometimes is fragmented, doesn't work very well. So City of Angels, we have a hotline number which is 609-910-4942 that you can call to get help. But it's about education. That's the most important thing is getting educated. We're dealing with a disease that is wrought with stigma and shame. So people, when they have an education program in school, back to school night, parents come in, they find out what it is, they leave because they don't want anybody to think that their family has a problem. So, part of the disease itself, part of fighting the disease has been kicked back into the back rooms. So we have to bring it out. We have to be more aware to get people to understand that there is a problem. It's not your father's addiction anymore. It's not about someone under a bridge in Trenton or Camden. This is happening. We have kids that blow out their ACLs on the soccer field. They get put on OxyContin, and when the prescription stops, they're addicted. So we're in for the fight of our life. And so there's many organizations like City of Angels that are out helping. The main thing about City of Angels is, you said I was a founder. I was one of many people who were like-minded, who wanted to help. But the beauty of City of Angels is that people that come and get help, whether they were addicted and they're now in recovery, or whether they're parents that come and get help, they're the ones that now run City of Angels. So they come back and volunteer in the future. So it's important about education and then giving back. The kids in the program say, you can't keep what you got unless you give it away. And that just means once you've helped, once you've been healed, give it back. And that's what we do.
We can pull together. You have to be united. There's strength in numbers. So the more people that are involved, helping people get help, the better off we are. And thanks for coming in.
Thanks for having
welcome.
us.
You're welcome.
Thank you so much. And we'll be right back. Don't go anywhere. We have an interesting segment coming up. Thank you. Welcome back to Addiction and Recovery TV. We're here today with guests from Enlighten Solutions, and we also have Terry Burns with us. So we're going to first start with Jen Hansen, who is the founder of Enlighten Solutions. And Jen, why don't you tell us a little bit about Enlighten Solutions?
Enlighten Solutions is a holistic substance abuse treatment facility that we founded just this past year. And we are a partial hospitalization program, intensive outpatient program, and outpatient. We kind of take the client through all the levels of care after detox and residential treatment. So, and we incorporate all the holistic modalities into that. So it's acupuncture, chiropractic, yoga, art therapy, music therapy, and it's really all integrated together.
In your experience, what has been the greatest obstacle?
I think, for me personally, it was my relationships. My relationships kind of always took me back into the wrong thing. But I'd say, for everyone it's different. Some people have a bunch of court cases that they have to overcome. Some people have lost their kids. Some people have lost their driver's license. Some people can't get a job and have no education. So you really have to look at what's going on with that person. Some people have serious pain and have been addicted to painkillers, and they don't know how to deal with that pain, without taking painkillers. So we try, and that's kind of where the acupuncture and the chiropractic comes in, because we want to show people that there's another way of dealing with pain besides just taking a pill.
Great. And so the holistic approach, very interesting, and it's enlightened. And so you also have with you today Rob Snyder. He is your executive director. Rob, you want to tell us a little bit about your functions at Enlighten?
Sure, I'm the Executive Director of Clinical Services. I work very closely with Jen, and so our day-to-day operations kind of look like the clients will start with acupuncture, and acupuncture sets them up for a calming effect as they go into group. Our group therapy, we focus on a 12-step modality, cognitive behavioral therapy. I like to do stuff on the brain and addiction. Cognitive behavioral therapy, and evidence-based. We use Living in Balance. So we also focus very heavily on family interaction. We believe in inviting the families in, so we have the families involved in our groups, if the family is willing to participate and if the client is willing to let the family participate. And then in the afternoon, we move into our ancillary services, and our ancillary services are yoga, art, music, therapy. We do Aikido. We do energy healing with Lucy. We also provide, Lucy's also an RN, and she also provides our didactic seminars on like HIV, hepatitis. So educating the client all the way around is important. We provide case management services, individual counseling, and it's very personal. So like as an executive director, I mean, I jump in the group, I run, I get out of my lane a lot, you know what I mean? I get out of my lane and I come into group and I'll run group and participate. Clients can come in and out of my office. We want it to be a very personal touch. There is no big eyes and little, U's, and it's a very open door kind of policy. There's a very good flow in Enlighten Solutions.
Like a family helping families,
Family,
right?
yes.
And so the clients that come for treatment, this day treatment, are they all, do they come and go at their discretion, or is there residential housing, or?
So it depends. I mean, everybody gets an assessment to determine their appropriateness. We have some clients that come in and they already have housing.
So they're outpatient?
And they're outpatient clients, and that's appropriate for what they need. Or, as we all know, sometimes we have clients that refuse the higher levels of care, a little self-directed, and we kind of work with them and just try to meet the client where they're at, because we know any treatment is better than no treatment. But ideally what we're looking for is the client that's coming out of detox or residential treatment that would participate in our partial care program. And we utilize housing in the area. Serenity Estates, they work very well with us.
So, and we have Terry Burns here today, and she's from Serenity Estates. So, Terry, can you talk to us a little bit about how you're linked with Enlighten Solutions and that housing component?
Sure. So I'm with the Hanson Foundation, which Jennifer Hanson also co-founded, and we have Serenity Estates and Serenity Houses, which is the sober living. So Serenity Estates are people that are in treatment, so they're sometimes in partial care or IOP, whether they're in, most of them are in Enlightened Solutions because we work hand in hand with them, but some of them are in the areas. So we'll take them on rides, we'll bring them to and from treatment. They'll go to a meeting every single day. It's staffed 24/7, healthy organic food. They go to the gym almost every day. You know, they'll go to yoga. And then they're more like a family there as well. You know, they eat dinner together. They play cards and, you know, heads up and all those games that they like to play. And, you know, they help each other. It's more of a family dynamic than anything, you know. And all our staff are in recovery, which is pretty awesome because we can best understand each other. So I love what we do.
So Ashley, we're going to ask you a little bit because you're going to give us the inside look of a day in the life of receiving treatment at Enlightened Solutions and then also residing in one of the houses. So why don't you tell us a little bit about that?
So in the morning we wake up, there's staff there, so for people that don't get up very well, the staff helps us, you know, get us out of bed.
So this is your house? You live
in the
apartment
estates.
Or a house?
Oh no, it's a 3-story home. It's gorgeous. There's like a bathroom in almost every room. It's nice living with everyone. It's a really beautiful house. So we get up, we get ready, eat breakfast, go to Enlighten, and then our day will get started. We start with group. It's like a group setting, which is, I think it works. We do have one-on-ones, but the group, you get a lot of feedback from the group, not just from the counselor, from your peers as well. So that's like an interesting dynamic. We do yoga, we have Aikido, we have different services after, which is nice. And it's...
So you see Rob and Terry, and from my understanding, Terry, you kind of are the lookout for all of help take care of the clients that are in housing. So you see Terry a lot. Has she been helpful? And Rob, do you feel like you can approach them?
Yes, absolutely. Terry's there sometimes, and we love when we get to see her. Rob's at Enlighten, and his door's always open if anybody needs to talk or anything of that. Yeah, it's very tight knit, and you feel like you belong there, and you can bring up anything that you need to with the staff at Enlighten. It's good.
So I'm going to bring the panel in. I'm sure they want to ask a couple questions, but before I do that, I think an interesting question, Ashley, and then we'll pass the ball to the panel, because we would like to know. We're learning a lot today about treatment and through this perspective of receiving treatment at Enlighten. And so, Ash, as being someone in recovery, can you tell us what has changed about your perspective about addiction or the disease and just from being in the environment at Enlightened Solutions?
Well, even just living in the house, just the structure, doing chores and having to be up and do certain things, I think it's been like extremely helpful, because otherwise, without structure or a plan, sometimes that is a recipe for disaster. So just the structured setting. But then even with Enlighten, doing things that you wouldn't normally be comfortable with, like I've never really done yoga and stuff like that, but it's like grown on me. And, routine is healthy. So it's...
So recovery. So you talked a little bit about the home environment and the treatment environment. Now from an addiction perspective, have you been able to understand the disease and gain a better perspective in the component of a problem that you may have had, and how has that developed?
Yeah, I've definitely gained a lot of knowledge on the disease, and helping me figure out who exactly I am and stuff. I think it's something that it's never just going to be learned. I think it's always going to be a developing thing. But yeah, I've learned a lot so far.
So are you, Ashley, prepared to deal with, are you understanding in the direction, are you prepared for what is ahead, and have you guys talked about that as a whole of what's up ahead in your journey?
Yeah, I think Enlighten does a pretty good job of breaking down the freedoms. So you start in like a partial care program, and then little by little you gain more freedoms, as opposed to just throwing you right out there. So it's definitely a transitional thing, when I'm able to get a job, and then I'll get like a cell phone, and I'll get like certain freedoms. So it's not just all at once. So it definitely is a transitional change.
Oh, so just for some clarity, when you are you're classified as partial hospitalization, knowing the different modalities of treatment, outpatient, IOP, and the step downs. So, which I believe, by the way, New Jersey should change their regulations to include transitional housing, but we can't get into that. So, is your program able to then, when she comes from partial, IOP, OP, and sober living, what about after the sober living? Is there
like a follow-up? Is that
well, not necessarily a follow-up, but another transition. Do you understand what I'm saying? So many people come from the sober living back to their environment, back to the problem.
Well, normally we see people in our sober living for up to 18 months. So by that time, they should have a good, long, 6 months, a year, 18 months, but they stay with us for a long time. And, we watch them all the way through that process.
So, and to clarify a little bit, Serenity Estates is where Ashley is at.
Right.
Those are the high-end houses where everyone is in treatment. And when they're ready, they'll step down, if they so choose, into Serenity House or other recovery residences in the area. It isn't strictly just, for Serenity. And we always come to them, and we just had this conversation not that long ago, like maybe last week, and said, we're looking toward the end of the month. This is what we want to do. What do you want to do? What do you think? And, of course, there's always that, oh, I'm so scared. But it's still, if she chooses
Good,
to
healthy
stay with
fear.
us, it's still us. The Serenity houses still run by staff. We still do individual case management. We help them meet their individual needs. It's very structured. They still have to make 12-step meetings. That's what recovery is about.
Absolutely, I think that's wonderful. And just so you know, that's a good, healthy fear. We get worried when you say, I can conquer the world. It's a very good, healthy fear, and I think it's a very good structured program, especially the 18 month sober living, because you're absolutely right. You would hope that, someone or your clients would have some type of routine of life, so to speak. I did want to ask you one more question. Do you find it difficult to involve the family with your clients? Is it difficult to get the family to come in to do the therapies and the treatment?
Some family, I think, is very open to it, and some some patients are very open to it, and then some patients don't want their family there at all. So we kind of have to work with them. Some families are supportive, and some families aren't. So you have to kind of find out all those things and really find out what's going to be best for the patient.
Yep.
What do you think?
Yeah, and so what we do is we utilize a group setting. So which means, Ashley's been recovering with people, and she's been part of a group process for a little while, and they get comfortable with one another. And we will actually invite the family into that group for a family session,
very good.
which we have found to be very effective. And in fact, clients they ask for it. They're like, "Oh, I want to do that." We find resistance sometimes with family members. They're like, "Whoa,
That's what I'm
going into a group setting." And then if they're uncomfortable, we'll offer a private and individual setting, and that's usually the second family session anyway. But you'll get a lot more input from her peers that can say things that maybe a counselor shouldn't say, because as you're working with a clinician one-on-one, we want to respect your privacy, and we might not want to share with your family member certain things that you share with us. However, a group member can just say, "Hey, are you going to tell your what about the pot in your drawer? And are you going to tell them about that?" It blows the lid off of things. And then sometimes they also bring the family in and kind of help the family see where maybe there's some enabling behavior going on.
Right.
And so we've had families leave and go, "Oh my God, I was on the hot seat." But they were like, "I liked it though, and I'm not going to give him his Xbox." And
right. So. Well, after all, the most effective group is run by the group members, right? So, we have spoke about the stigma of addiction. Do you think that some of those family members that are hesitant to come. Do you think that it could be possibly due to the stigma of addiction, where they don't want to be associated, or they're in such deep denial that they don't even want to hear the word "my child" or "my family member" has the disease of addiction?
I would say, I mean, unfortunately, and what's going on in today's day and age, we're seeing multiple treatment experiences. So we're seeing families that have a little bit more experience now. Like, this is not my child's first treatment experience. We have had some families that this is the first time and they didn't want anything to do with being seen, you know, very concerned, trying to link them up with outside sources like a family program too, and that are local. No, I don't want anybody to see me. You know, and just getting them to get involved in a family session was like pulling teeth.
Right.
But they loved it when it was done.
Right.
And Ken, you had a question as well that you wanted to ask.
Yeah, I mean, I think everyone's pretty much answered it. I mean, I have a comment, though, that I really like what I'm hearing, because that's what this show's purpose is, to actually let people know that there's help available. I like the long-term idea. I like the structure idea. I like transitional steps, and how your program is really tailored to an individual, because, you know, addiction takes people to different places. You know, some are still, you know, drinking tea like this, but they're addicts, you know, and then some people are laying in the gutter. So I really admire that, and I think as a panel here that we're all uniting to face addiction. We want people to know that you can make a phone call and get the help you need. You know, some will go there, some will go there. Our big thing is that we're really tired of people dying. And we want to make sure that we're in position to carry what needs to be carried. We're chosen to do this. Thank you very much.
You're welcome. Johnny, how about
Yeah,
treatment perspective?
Yeah, treatment perspective. I was thinking about when you guys were giving your layout about what the program entails. A lot of times, and clinically speaking, co-occurring disorders. You know, I wanted to address that because, you know, I was hanging on your word, and you know, and it seems like we all do that as clinicians, as officers of a company or whatever it might be. We overlook that a little bit, and it's tend to, you know, keep going if we don't address it. So I was wondering about that part of your program.
So this is going to sound a little, I hope this doesn't sound arrogant or anything, but we have Dr. Charles Musburger, who's our psychiatrist and medical director. And he's particular. Like, he does not want to not necessarily utilize an APN, but he wants to do all the assessments, all the follow-ups. I mean,
That's good.
so, it's great, but we love him. And we have 2 duly licensed clinicians to deal with our co-occurring clients. So, and our clinical team, I couldn't be more proud of them and what they do and how they handle certain situations. We have a clinician who primarily focuses in on the substance abuse, and he runs our groups and whatnot. And it's almost like they play off each other very well. I mean, because these are different. You know, you're treating substance use disorder, but then you also have some anxiety and depression. And
is that what co-occurring is?
Yes.
Or not revolving door occurring?
No. Right. So, and so, you know, we have the normal, you know, our clinical meetings once a week. We pride ourselves in having daily meetings as well. And then we do overall staff meetings once a week as well. So communication is key because, you know, we've a lot of experience with, well, I didn't know that or didn't know this or you didn't tell me that. And so you could do great clinical work, but if that doesn't get communicated, let's say Ashley's having a situation today in treatment, how does that get communicated to the rest of the treatment team? So we believe that we got to communicate every morning, and then we know, like, okay, let's not be so hard on Ashley today. Ashley shared something with a therapist. She may be acting out. There may be some behavior associated with what she shared. How do we support her?
Well, this is fascinating. We're getting an inside look here of treatment from a perspective of a facilitator and a client and support services. And so, Ashley, as the client, closing remarks of just what you would share with the viewers about either having a problem, a substance abuse problem, and or someone that's interested in receiving treatment, or possibly someone that knows someone that needs treatment.
For anybody that's looking for treatment, you know, it's never too late to get help. You know, I'm so thankful that I was able, to get into where I'm living and also my treatment center. And it's been, it was scary, and now like there's hope, and I can turn this around and I can do something good. Another thing too, like I love the organic approach of things, and like, because I stopped putting junk in my body, and if I wasn't there, I would probably still be putting, other foods and junks. So, just the healthy lifestyle is so important, and definitely utilizing it.
Awesome. And Terry, what did you want to tell our viewers in closing?
Well, that help is possible and that we do recover. And if you need anything, call anytime. And are you going to put the number and everything
absolutely.
on the...
The information is provided. We will give all the information if you have anything. We have these brochures that we have today. So if you come, is there a way for people that aren't at the facility to get this? Is this information all online?
There's a website, enlightensolutions.com.
And so you'll see that and take advantage of contacting them if you have any questions, and they will let you know how to proceed. And with that, Jen, so the floor is yours to, in closing, what you just want to tell the viewers, so in case we missed something, you can let them know.
I just want to say that, help is, there's always hope. Whether someone's been in one treatment center, no treatment centers, 20, 50 treatment centers. I mean, we have seen people that have been in a lot of treatments, and you never know when someone is going to, when that switch is going to come on, and someone is going to, come alive and really decide that they want recovery, because it's really up to the addict. They have to really want recovery, and they have to really be willing to work for it. There's only so much we can do as treatment providers, as, sponsors, or, we can lead a horse to water, we can't make them drink. So, they have to really do the work, and you never know. I never give up on anyone, because no one gave up on me. They were there for me, and they drew a hard line. My parents drew a hard line and said, we're only going to help you if you're willing to go for 6 months at the last one.
Right.
But there was people that were there for me, and that one worked. And it's almost 20 years later, and it's still working. But I'm still working at it. And that's the major thing. I'm still working at it 20 years later. And that, it's a continuous process.
That's the game changer, and so
Yes, it is.
we are thankful for your time, and we want to encourage anybody who's listening or watching to please reach out and contact us and contact treatment. Either make sure that you take advantage of the information provided and make contacts. The help is available, the help is working, and we just are encouraged by what is happening today in treatment and recovery. And we just thank our guests so much for being here, and we look forward to following up, and perhaps maybe you guys will come back on and sometime down the road and share with us what
More successes.
more successes of
Right.
what's,
Yeah.
and you'll share with us more successes. And
The only time hope is gone is if they're gone. You don't have to die.
Hope, helping other people every day.
That's
take
right.
a look at that information on the screen when we go to break, and we will be right back. Don't go anywhere. Thank you for joining us. Welcome back to Addiction and Recovery TV. We had a great show today. We had guests from all over in regards to addiction and recovery, and I think that we painted a nice picture of what's going on in today's society with addiction and recovery. Ken, what did you get out of today's broadcast?
Well, I mean, there's just so many resources available out there. Addiction is out of the closet, so let's bring it home. Let's stay united. Let's make it happen. Let's help other people every day.
Deborah, what did you think about today's?
Well, I think it's wonderful that there's two of the guests here today had just started the treatment facility in the last year. So I just really think it's wonderful. People are starting to really be focused on trying to help addiction, and the revolution is starting.
I like the united force of all of us, and that's what I got out of our show today. And I just want to say, please join us in our endeavor to combat addiction.
So we provided valuable information. Be sure to check that out, and especially if you know someone that you can help, especially if you know someone that needs that Narcan treatment, find out how to get that into your hands, because we want to save people's lives. We want to hear from you. Contact us. We'd like to have you on the show. We want to hear your story. And not only are we offering support, but we're asking for you to let other people know about this broadcast, because together we are overcoming and winning against this fight. Thank you so much for joining us, and until next time, be encouraged. And thank you for joining us here at Addiction and Recovery TV. I'm Charlene DeChico, and I'm joined by
Deborah Braden,
Ken McDonald,
John Raggio.
and we are Addiction and Recovery TV.